The Albuquerque homeless population has a large proportion of drug addicts who are unable to receive substance abuse treatment. This is due to a number of factors, chiefly among them the lack of easily accessible treatment options. Substance abuse is a primary causal factor in the city's high homelessness rate and contributes to increased hospital costs when addicts look for help there rather than in specialized detox centers. The substance abuse rate has remained relatively constant for the past 10 years. A 2007 study showed that 22.9% of surveyed homeless people cited alcohol and/or substance abuse as a reason they had to leave their last permanent residence. A 2017 study showed that 28.9% of those surveyed had problems with substance abuse. These statistics show that not only is the rate of substance abuse among the homeless population of the city of Albuquerque exceedingly high, but that it contributes to the overall high homelessness rate of the city. It is evident that measures already taken over the course of the last decade have not been successful in reducing the problem to an acceptable level. I propose that you, the Albuquerque Family and Community Services Department, begin a program of comprehensive building and education with the goal of making it easier to access treatment services and lowering the rate of substance abuse. The first step is analyzing existing information to determine where improvements can be made. I've written up an analytical report detailing the problems the city is facing in this regard, so this proposal will move forward with the later steps. Step 2 will be to determine the possible solutions to the problems discovered in Step 1. And the final step will involve the implementation of these solutions in an efficient and effective way. One large problem the city faces in treating substance addiction is a lack of funding to organizations that provide detox and other services. Due to this, existing clinics tend to be small and understaffed. What staff they do have tend to be poorly trained. By allocating money to privately and publicly run treatment centers, these problems can be alleviated, and the ability of these centers to treat homeless clients will be improved. Fixing the problems facing existing centers may be part of the solution, but there still will not be enough space to treat both homeless and non-homeless addicts. By allocating funds to build more treatment centers in at-risk areas like the downtown, pressure on individual clinics is lessened and better care can be provided to each patient. Many of the homeless people surveyed reported trouble finding and gaining access to the treatment they needed. After the implementation of the preceding two parts of Step 2, a continuing advertising campaign could be run to inform those who need help on where to find it. These advertisements would be placed in areas where they will be likely to be seen by at-risk populations: billboards, bus ads, and similar. Anderson, Basson, Boland, and Cartwright estimate the cost of inpatient treatment to be, on average, $2,773 per month per person, with outpatient costs averaging $636 per month per person. Of the estimated 5,000 homeless people in the city of Albuquerque, 22.9% cited substance abuse as a reason they had to leave their former residence. The solution to this problem is twofold. Firstly, increasing the capability of existing facilities to provide for more patients will involve working with the existing 20 facilities in Albuquerque to increase total capacity by 500 homeless patients, with larger facilities handling a greater proportion of this number. The need to build new buildings to house these patients can be avoided by relying on less expensive outpatient care, requiring only the payment of $318,000 per month for the work of healthcare professionals, which could be paid for by grants from the state or federal government. Second, new facilities must be constructed capable of housing a total of 645 patients. Estimates by Sue O'Connell put the cost of facilities this large at about $190 million, assuming the cheapest possible land. Monthly operating costs would total around $10 million. Both of these costs could be paid for through state or government grants. Costs could also be reduced by converting already built warehouses or other buildings, and by primarily providing outpatient care, which is cheaper. To advertise these expanded services, 500 ads for the interiors of buses could be made. These would cost between $20 and $125 per ad per 4-week period, for an average of $36,250 total each month, potentially less due to government discounts. Hundreds of people in Albuquerque are suffering from the effects of substance abuse. Current programs are not doing enough to help these vulnerable members of the community. To combat this, the City of Albuquerque Family and Community Services Department should implement some of the aforementioned solutions to reduce the scale of the problem. It is within the power of the city government to provide the care and treatment these people need. Let's help New Mexicans help themselves.